All right, you're probably wondering why I'm standing with a bunch of balloons. As physicians or business owners, there's a lot of different hats that we wear. Marketing, training, patient education, managing staff, doctor, dealing with cash flow and insurance, all sorts of different things that are going on in your world at one time. Now, it wouldn't be all that bad if this is all you had to do is hold them, but we've got to do all these at different times and all at once. So here you are trying to juggle your life of your practice, and the next thing you know, your family wants you to have some time involved, and you can't keep them all going. This is how I feel at times. And what's most important in my life is here, is my family. But in order to be the best dad I need to be and best husband, all these other things, these balloons that now all around me and fall on the ground, I've got to find ways where I can give them to other people, or have ways that can be automated to where I can take care of all the different things at once and really be able to oversee my practice and my patients. I always say I love treating patients. I love seeing people's lives change. But part of seeing that happen, we have to make sure we have a business to go to. A system I've been using like this called Thrive. That system allows me to do just that, to thrive. It allows me to be a business owner and be able to track what's going on inside my practice, automate a lot of these different things. Automate a lot of my marketing, automate a lot of my stats. What I say, what you focus on expands. And so with the Thrive system, it automates my practice management software with my marketing software, to where it ties into when a new patient comes in and tracks them through that process of exam, report of findings, what type of case did they choose, and then if they chose a case, different emails go out to them to educate them and empower them on improving their health. At the same time, if they chose not to take care at that time, to nurture them back along the road to where they can eventually, when they do have a problem again, they think about me and they think about what we do. At the same time, then empowering my staff. This system, because it's automated, it allows us to do these things without staff time and without my time. So every morning I get an email of what happened the day before, what new patients were seen, what my practice numbers will be, what is the cash flow, okay, what patients I need to follow up on. So I'm able to very quickly, as I'm driving home that night, if I need to make a couple phone calls, great, or make a couple phone calls in the morning to just check on some patients, I can do that. At the same time, knowing those stats, knowing those numbers, it allows me to see what my staff are doing. Instead of having to watch them, I can manage it from a numbers perspective versus a personality perspective. That Thrive system has been a great benefit to me. I've been using it a couple months. In the first month, it brought in over $1,000 for me. And patients I haven't seen or came back into the practice. Now using it after about 3.5 months of using it, it's brought me in about $5,000 to $6,000 worth of patients that have come back into the practice. Okay, and the nutrition that they bought. Now, not only has that been neat, it's been neat to see some of these patients that I've seen years ago. One of them came in and said, you know what, I haven't seen you in a while. Thanks for that email. And I brought my son back in. Remember him? He was like 8 now. He's like a baby when I saw him. He said, you adjusted him 2 or 3 times and he quit having ear infections. That was fun. It's fun to be able to get reacquainted with some of these patients. So, doctors, a lot of times we lose patients. Not because of something we chose to do. It's just they got busy in life. If we're not reaching out some way, shape, or form, if it's not automated, who are they going to think about the next time they need somebody? So I'm grateful to have that Thrive system. Allows me to do that, to be able to automate my emails, automate my practice, see what's going on, and also be able to make better decisions on that. It's a great system. If you want to look into it, take a look at it. Do a demo. Okay, very inexpensive what to do. I've paid for multiple systems to do this. I have 2 systems that I've been using. One cost me $200 a month, which I'm not using more pretty soon, and I've had another one that cost me $400 a month. This system is less than both of those. So less than the one that's $400 a month. Why? It's your choice. What you want to do. Look at your options. Look what you want to do. Okay, but do something.